Hi, I'm Marybeth Van Horn. Welcome to Nurse Chats. And today we're going to be talking about telemedicine. And by now, I think, many of you understand that term. Telemedicine doesn't necessarily mean on the television. It's a term that's used for a face-to-face consultation with a care provider that is not in the office but by media. So a lot of us have been exposed to telemedicine. Maybe some of us haven't. Today, what we're seeing is that doctors are visiting with their patients on a video call as well, what they call a video call on a computer, or a telephone is a computer. It's a computer with a phone in it. But anyway, it's a mini computer in itself. But the doctors are now chatting with people face to face and being able to actually see the person. When a doctor evaluates a patient, they want to see the patient for a couple of reasons. There's the data, the hard data, the vital signs, and things like that are lab results, chest X-ray test results. But the doctor also makes what we call a clinical evaluation. So if a patient is telling us they have certain symptoms, oh, by the way, I'm a nurse, not a doctor, but if a patient tells us they're having certain symptoms, we're looking at them to determine what does their skin look like, what does their energy look like, how are they walking, what are they exhibiting, and that's called a clinical correlation. Okay, so when clinically we look at a person, we're saying this doesn't fit, or it does fit, but it doesn't fit with what they're telling me, or it does fit with it. And we're trying to figure out from looking at them as well as talking to them, as well as the data. Okay, so there's data and there's clinical evaluation. Data. I'm a big believer that the doctor should have the data. It's nice that they're doing the telehealth and talking to people, but if they have no data because they can't see you or haven't seen you, there's a missing piece to that puzzles, right? So we're big about the fact that it's called remote patient monitoring and chronic care management. They may or may not be terms you've heard, but those are ways that now we have available to us where the doctor can look at data readily while you're in your home. So the example would be if you have what they call peripherals or biometrics or whatever word you want to put on it, blood pressure, blood sugar, weight, temperature, oxygen, pulse, oxygen sat, O2 sat we call it. And many people are familiar with a pulse ox, right? So it's a pulse and oxygen reading. And so those parameters, that data put together, formulates a picture. It's not just a blood sugar, just a pulse ox, just a weight. It's looking at the whole picture. So that's why when you go into the doctor, they take what they call the vitals and they do your weight and everything along with that, right? So that lends to then the clinical evaluation. So people who are just visiting with their doctor on their phone or by a video and don't have the equipment, that is, I think it's just necessary to do the vitals from home where the doctor can look at them, and they go into a Bluetooth and into a cloud location, so the doctor can pull them up while the doctor's looking at you. Or if you're not even there for a visit and you've had problems, let's say with congestive heart failure or high blood pressure, hypertension, or blood sugar issues, the doctor can actually look at the data anytime to look at the trends. And that's another thing we look at when we look at patients' big picture. What are the trends? It's not just a blood pressure once at the visit. It's a trend in the blood pressure if a person is at risk for having issues with their blood pressure or blood sugar or oxygen or weight and those kinds of things. So it's not just one weight at one time at the visit. So I'm very vocal about this. I think it's very important that people listen up and understand, doctors and patients alike, that there is technology available today, paid for, I should say reimbursed by insurance companies, and particularly Medicare, has come out with a landmark decision, to pay for remote patient monitoring, and the equipment, and the education, and for the doctor to look at the data. So the doctor actually is being paid every sequence that Medicare allows. Let's say it's monthly, and so for him, the doctor, to look at the data. Let's say it's daily. Let's say it's weekly during area times of acute problems. That doctor can be paid for that. And chronic care management is now, again, Medicare came out with a new ruling that instead of 2 diagnoses, you can have 1 diagnosis, which opened the door to everybody: cardiology, nephrology, neurology. It goes on and on. So they can have 1 chronic condition now, and have remote patient monitoring, chronic care management reimbursed by Medicare. It just makes your telehealth visit that much more impactful. Okay, telehealth is here to stay. It's not going anywhere. COVID-19 sure brought that to light, but remote patient monitoring, chronic care management is here to stay. And I can only see that in the future it's going to expand from there. So it's not going away. I'll tell you more about that. Okay, talk to you soon.